My name is Matt Tobey. I grew up in a small town in upstate New York. Um, and I always thought that I would be a small town primary care doctor. I came to Boston for college and medical school. I did medical school. I was really influenced by some of the team here in Boston that works for the Boston Healthcare for the Homeless program. They're just fantastic physicians who I had the opportunity to work with when I was in medical school training. And I wound up applying into internal medicine and matched to residency at Mass General Hospital, where I've been since 2011 now. I was a resident in a global health and primary care program in internal medicine. That was really a wonderful opportunity for me. In my second year of residency, I was lucky enough to be invited along on a trip with the Indian Health Service to South Dakota. And I can talk more about that work, but that's where I'm still involved today, now that I've been a member of the physician team at Mass General and faculty for 4 or 5 years. I also did a chief residency year at Mass General. And nowadays I work with a lot of hats. I work as a primary care doctor with the Indian Health Service in South Dakota. I cover the hospital unit at that same Indian Health Service hospital in South Dakota. At Mass General, I provide care from time to time as a teaching hospitalist, and I've also worked at Mass General Chelsea, one of the primary care clinics. And most of my time is devoted to building a partnership between Mass General and a indigenous community in South Dakota, the Sichangu Oyate, or Rosebud Sioux Tribe, which is where the Indian Health Service Hospital and Clinic is based, where I work as well. So it's been an incredible job and quite a journey from growing up in a small town upstate New York in a sort of rural corner of the country to getting to be that small time doctor in South Dakota, and also being connected to Harvard Medical School and Mass General Hospital at the same time. So I feel lucky every day to be able to do this work. Advocacy is a really interesting word that we use in medicine to describe a lot of different activities. I was listening to a wonderful physician from UCSF give grand rounds this morning at our hospital about care for homeless populations in the Bay Area. And, 100%, this is someone who I would be, oh, there's a physician advocate. But whenever I'm asked to define it, I struggle a little bit as to, what exactly does that mean? One way that I've heard it broken down is that there are different levels of advocacy that physicians do. There's advocacy at the level of the patient you may see. So, for instance, there was a patient at our rural hospital who had a really terrible outcome recently. I know her quite well. And she, to see this happen to her was really horrible over the last few weeks. Before I even knew what happened to her, the other physicians who work out of that hospital were working to fix the systems that had failed in that case. So there were some issues with blood culture results reporting in the lab, and people were working on how those results get reported and documented, and how patients get called and if needed, tracked down in the community by a team of public health nurses at the hospital. And that sort of patient level advocacy to really, if in the worst case scenario something bad does happen, to work really hard to change the systems that are affecting that person is a really big deal. And I think so important. Another form of that patient level advocacy that gets discussed a lot, and I think is really fantastic, is through partnerships with other sectors. So often in healthcare, we're in sort of a little bubble in our clinic where we're taking care of a patient, managing their medications, making referrals in the health system. But there are also programs where you can refer people to other systems, like to a lawyer, for instance, and there are fantastic medical legal partnerships. It's hard to sum up being a physician advocate more than actually sending them to a legal team that can literally advocate for their legal rights and privileges. So that's another example of patient level advocacy that I think is just really incredible, and there's been some pioneering work in and around the city of Boston to do that as well. Um, there are other forms of advocacy. There's advocacy at the community level. There's advocacy at the state level. There's advocacy at the national level. There's even advocacy at the world level. And so those sort of higher level forms of advocacy wind up being a little different. It often winds up having to do with funding, with access to grant monies, with the laws that dictate how healthcare is delivered, and the systems that describe how healthcare is delivered. I knew we'd be talking about this today, and I checked the healthcare spending in the US is about the same size as the economy of Germany. That's the fourth largest in the world. So being an advocate within the US, there's just this huge opportunity, I think, to um, talk about and potentially redistribute the $4 trillion that every year is spent on health in this country. And I've had the opportunity to be involved in some of those conversations, and it's really an incredible thing. I mean, there are people who are so dedicated to building a more just world, pretty much everywhere you look. I mean, it's really incredible, and sometimes those people have the opportunity to do it, and to be someone they reach out to for advice as a physician is an incredible privilege, but one that many folks in their medical careers may well have. So it's great to talk about this right at the beginning of people's medical careers, and I'm happy to share some examples of how I've gotten to be involved in that level of advocacy. I think anyone who's not just seeing folks in clinic, but really working on health equity, uh, maybe deserves that title of physician advocate, whether it's at the community level or the patient level or at the national level. And I think it's really important to recognize people for that work, because it often goes, sometimes it's not remunerated, sometimes it's not appreciated. But those are the folks who are making the healthcare system better every day. And our healthcare system is getting better every day, as many challenges and injustices as there are cooked into it. So, I guess to describe the pieces that I've been involved with through time, just briefly, one of the first things I did after residency, which I haven't mentioned yet, is that I worked in the correctional health system a bit. So I helped provide care in a few of the local jails, and then helped run a student clinic for Harvard Medical School students and other students at the county jail on Nashua Street in Boston, the Suffolk County Jail. And, that was an incredible opportunity to introduce a lot of folks to the care, and, for all its strengths and all its blemishes that happens in the US correctional system. And I had the opportunity to do that work for several years, and working with students and also with faculty to try to improve those care systems was really fantastic. And I think part of the way that we wound up being advocates is there are very few connections between the world of academic medicine and the world of correctional healthcare, or healthcare that happens in jails and prisons in the US. So being at that intersection led to many opportunities when policymakers or others were looking at ways to reform and advance healthcare in the correctional system. All of a sudden there's a small group of people you might reach out to for advice, and that is likely to be the folks from the teaching hospital system who are connected with correctional healthcare. So although that became a little bit less of my career, I saw a lot of my colleagues, really directly involved in the policymaking. And, there were several major criminal justice reform bills that were either proposed or in one or two cases passed in the state legislature over that period of time. And being able to be there and say, hey, things like medication assisted therapy for opioid use disorder, are evidence based and really have a role in every jail and prison. Being able to say that and advocate for that was a special opportunity. Nowadays, the work that I do is largely in rural and indigenous healthcare. And as a non-indigenous person myself, very cautious to, where I raise my voice, and whenever possible to amplify the voices of the community with which we work. And Mass General, to sort of honor that, formed and signed an agreement with Rosebud Sioux Tribe, which is our partner indigenous community, and as a memorandum of understanding to sort of state what we would do and how we could support the community, but also not sort of get in the way of that formal tribe to government relationship that exists. And so, it's really been a neat thing through that agreement and through this partnership to have the president of the tribe often check in, if there's an issue going on, for advice. And then, his voice is a very important voice in the national dialogue around healthcare. So being able to build these bridges between teaching hospitals and rural indigenous communities has been a really special thing. The other phenomenon that happens is that there are folks in government who are trying to come up with the best policies for healthcare in rural America and in indigenous communities. And so they will often reach out through their networks. And so there were folks in a few of the different Democratic campaigns who wound up connecting with different members of the team from Mass General who have been doing this work in South Dakota. Some of the conversations that got discussed have already been turned into law through the stimulus bills that have been passed over the past year during the pandemic. And certainly in the sort of loud cries that we and others have made for increased funding of the Indian Health Service and of some of the tribal communities in the country. So it's been really neat to sort of be part of that dialogue on both sides, and just be everything we've done has really been in response to the community, which has asked for rural physicians. And so to some extent, what our program is all about is just being rural physicians. But by doing that, you become an advocate because you're connecting these very disconnected networks where, you have the teaching hospital networks, you have the, folks who are making health policy, and then you have these rural communities that are, otherwise often quite isolated from the teaching hospital world. In an ideal world, I don't think we'd be necessary at all. There'd be great doctors there. There'd be direct connection between those parties. But, as everyone is working to make the world more just and, address systemic racism, address the genocide that happened in this country with indigenous peoples, there's a lot of opportunity to, either by intention or by accident, become an advocate. Yeah, I'd love to talk about the work in Rosebud. So to be clear, I was really fortunate through the effort of a lot of others to get pulled into the idea of a partnership between Mass General and Rosebud back in 2012. And it would never have happened with a lot of really fantastic folks. The Harvard University Native American program being a really important factor, the leadership at Massachusetts General Hospital being a huge factor, and the leadership of the Rosebud Sioux Tribe and the Indian Health Service being really important factors in those partnerships. What happened was in 2016, MGH started providing direct clinical staffing to this hospital in South Dakota, which is not something that is a very common occurrence in the world of academic medical centers. So it's been really a learning experience for everyone and how to build a partnership like that. It's been amazing for this to be my job to, help solve just the flurry of challenges that arise, but also the incredible opportunities that come out of a partnership like that. And there have been so many folks involved, it would take probably hours for me to list them all off and what they've done. Right now, we have a team of internal medicine docs who are largely staffing this clinic, a few family medicine folks as well. And there are about 5 people on the core team of us right now, all of whom spend a good portion of our year providing care at that hospital. And then there are about 15 or 20 more who come in for shorter periods of time to help fill the gaps and staff the inpatient ward at the hospital. And the Rosebud Sioux Tribe was very focused initially on that clinical staffing plan. So that has been the heart of what we do as a direct response to the tribal nations request to do so, and that's always been something that we've worked really hard to honor. There are also a lot of folks who help in other ways. So a lot of student rotations for medical students, nurse practitioner students, PA students, and medical residents that we help sponsor and supervise at the hospital. And we're always working to develop those programs more. The other piece is direct community engagement and work. And so we've helped the Tribal Health Administration, which is the sort of administrative branch of the community, develop their health programs through grant writing help and through helping get some programs off the ground. And in all of that, we really take a back seat and let them do the work, and just make sure that we're in touch. So if there's the need to write a grant or get a little bit of advice about how to run a mobile health unit or a detox center, we're available and making connections and investing our resources to help. Again, I think it's largely been unintentional to sort of get involved in this advocacy. Working in South Dakota and with the Indian Health Service, so the Indian Health Service is funded at about $4,000 per capita, and the communities it serves have some of the biggest disparities in healthcare outcomes of any communities. And the average U.S. spending on health is $11,000 per person. So trying to get by in about a third of dollars and a lot of challenges is just really brutally difficult on the health system. So the problems we run into every day, some of them have to do with getting physicians out to South Dakota, and that's how we've been able to respond. But then if you have a patient who has severe osteoarthritis of their knee and can't walk any longer because they need a knee replacement, you rapidly realize that the issue preventing you from providing the care that you want to provide is that the patient doesn't have health benefits that could pay for the surgery. And you learn that South Dakota has not expanded Medicaid coverage as broadly as other states under the Affordable Care Act. And so, in fact, you're the only state of all, or one of the few states that has a large Indian Health Service presence that where you can't get these services for your patient. I remember one of the first things I did was write an op-ed about that in a small paper in South Dakota and say, hey, it's crazy we can't get patients the care they need. And I remember it ruffled a bunch of feathers. It was one of my first learning experiences. I think it was the first year I was on faculty. And, it didn't lead to direct problems for our partnership, but it taught me a lot about, how closely people pay attention to what's written and what's discussed about health policy in the country. And, we all carry a lot of power as advocates, for better or worse. We have incredible privilege. And I think learning how to use that, to be good custodians of that power and privilege is really difficult. I remember feeling just racked with uncertainty. Was I damaging this young partnership that, could eventually, lead to really positive things by, sort of aggressively advocating for something that, to be entirely clear, I was asking, why isn't the South Dakota governor expanding Medicaid, which was a very unpopular opinion to have among the sort of political party in charge of South Dakota at the time. And so, the decisions we make and the things we say and do can have really substantial impacts, and it can be so hard to weigh the pros and cons of things. And often, in that case, I don't think there was much question that it was sort of the right question to be asking. I still don't. But I guess I learned to advocate in somewhat different ways, and often through work, right? I think our work can be advocacy as much as anything. Being a good clinician and sort of keeping one's head down sometimes is the best thing to do. But it's really hard. I think the other aspect that comes up a lot in doing some of these, in working in these spaces, is the tension between being an advocate, which often is taken to be, being sort of outspoken and saying that what you think is right, and being complicit in the system that you're working in. I think the Indian Health Service is a mechanism by which the federal government has failed its treaty obligations to United States tribes. And I, work in the Indian Health Service and have for many years now. The same is true when working in healthcare in a jail. The way that healthcare is delivered in jails right now is unjust. There's no question about it, and it reflects structural racism and affects, it's hard not to see the very clear injustices of our society through that work. And so I think one thing that we all have to struggle with, no matter what our jobs are how much we're sort of raising our voices against the injustices in the system, and how much we're able to tolerate sort of continuing to work within these unjust systems and be part of them and perpetuate them. And there's no totally clear answer to any of those pieces, but it's something that I think sticks with a lot of us and is very complex and important to wrestle within ourselves. I love that question. It's a wonderful question. And so in front of all of us, both at the beginning of our careers and then every day throughout them, I think we're always being backseat drivers a little bit and being like, oh, am I doing the right thing? Is this meaningful to me? Is this the right thing for me? And I do think we have to trust ourselves that whatever we choose is okay and the right thing, and affirm ourselves in that. I think I would be really happy as a primary care doctor at Mass General. I have been, for much of my training and the intervening years, to get to know people so well. It's incredible. And I've known since I was, a child, that this was such a special career path. And I've never wavered on that. And I'm so lucky that I get to do it. One thing that I've had the privilege to experience through the work in Rosebud, and to be clear, it's been very hard. It remains very hard. The challenges that we face every day test us in ways that are often very painful, and have been very painful for me, and for I've watched other people go through a lot of pain and suffering through this work. There is a lot of meaning, I think, in having a career like the one that I've been fortunate to wind up in, but that at the same time doesn't mean that it's the right thing to do. There's no sort of absolute moral compass in this world. And I do think a lot of people come to our team, and again, I don't want this to seem like it's just me. This is a large group of us who are doing everything we can to build these connections. But a lot of people come to us interested in joining in the work, even in a small way, for a week or two, or making a donation, supporting the local Boys and Girls Club in Rosebud, or I'll run into somebody who works at a in government, who says, oh, this is so important, I've been meaning to focus on this, how can I get involved or do a better job? Or somebody who works in a related sector like law or education, what are the issues, how can I get involved? And so I really think so much of this effort, and about advocacy in general, is really connecting people. I think the more connected a world we have, the more lines of difference that we cross, the stronger we all are as a society. And I think we really struggle to quantify that to an extent as a society. I think the more connected we are, and there are so many ways in which we're more connected now, through social media, through academic connections, writing a blog post, all of a sudden, people you'd never imagine are reading something you wrote. And so, I think there's just been a ton of progress through the past years in so many regards of getting us connected. We often, for the folks who go out to South Dakota, we explicitly talk about the lines of difference they're crossing, because we think it can be so disorienting to cross those lines of difference without really thinking about them. From urban to rural, from non-Indigenous, academic medical center. And many of our academic medical centers really suffer from not having Indigenous connections to an Indigenous healthcare system. From a blue state to a red state, from an urban place to a rural place, from a federal hospital, from a teaching hospital to a federal hospital. Those are all just huge barriers to cross. And by doing it, there really is something added, not just for you as a professional and not just for the healthcare system, but for society as a whole. And so I think there really are advantages in doing that. But people find ways to do that no matter what work they're doing, whether it's getting more involved in your local government, whether it's asking questions in sort of the research sense about the injustices that underlie our healthcare system. There's so many ways to do the work, and there's no right or wrong answer. I'm I often the grass often looks greener. I'm often like, oh, maybe next year I should be a primary care doctor at MGH again. Maybe that would work well for me. And I know there are lots of people looking the other direction. So I think the important thing to do is to take care of one another and ourselves, and be good to ourselves, and strive to the extent that we can toward a better and more connected world. If I could say one thing to the first year students at HMS, I mean, it would be follow your heart, of course. I hope that's what everyone is saying. And, it's a dizzying path that we all walk through life, no matter where we're coming from. But entering medical school is a big dizzying realm of opportunities. And, there will be so many people at Harvard Medical School and through your medical training who you'll really look up to, you'll learn from, and there'll be so many peers and friends and patients and others who you'll learn from along the way. So, have fun and never, don't worry. Your path will be clear, and you'll find the meaning and the joy you're hoping for.